Welcome to Whistle Where You Work. I'm Mark Cohen of the Government Accountability Project. In a few minutes, we'll consider the very real prospect that the Supreme Court may strip consumers of their right to sue drug companies for harm caused by the drugs. But first, when science and politics meet. Much of the scientific community has been up in arms throughout the Bush administration, charging that the White House is suppressing science or just plain making it up to serve ideological and theological ends, or simply to please corporate patrons. Birth control, stem cells, climate change, evolution, safe drinking water, you name it. When it comes to science, critics say the Bush administration has, in Chairman Maos' term, put politics in command. Here to grade the Bush administration on science and forecast what we might expect from the next occupant of the Oval Office are Dr. Francesca Grifo, who directs the Scientific Integrity Program for the Union of Concerned Scientists, and Rick Piltz, a former federal climate program whistleblower and now the director of Climate Science Watch, a program of the Government Accountability Project. Welcome, Rick and Francesca, to Whistle Where You Work. Francesca, start us out. Lay out what the Bill of Particulars is against the Bush administration on science.
There have been a number of different things, all the way across the board, as you mentioned in your intro, from the topics, everything from lethal drugs to lethal lunchboxes, a whole variety of things across public health and the environment. But I think what's important is to distinguish between all the different kinds of abuses, falsification, fabrication, but not only those examples that we're familiar with, but there's a whole set of examples we're less familiar with, and those are the ones that are really frightening. These are the ones that we call changing the rules, the ones that embed deep in the bureaucracy these changes that, first of all, because our government is not so transparent, we're having a hard time ferreting them out and knowing what they are, but also to change them requires, just a real leadership.
For example?
For example, endangered species. There is a table floating around in the Interior Department where no longer, when you want to have a species listed, you come in as an outside person, you put in information, and what used to happen is Fish and Wildlife would go into their records, the biologists would use their ability to pull in more information. Now that table goes up the line, there's only one column. There's a place where you can only put information that would not support that listing, as opposed to supporting the listing. So, we have a misguided, not all the complete science going forward. So these little tweaks early on in the bureaucracy that change the outcome.
Rick, you were kind of a poster child during the Bush administration for problems in the climate program and problems of scientific integrity in the climate program. Tell us about what happened.
Well, I was working in the coordination office of the federal multi-agency program that supports all the scientific research on climate and global environmental change. And I had been there since the mid-1990s. When the Bush-Cheney administration came in, we saw almost from the beginning a change in the relationship between the White House and the science program. The White House clearly was not going to support a regulatory policy on greenhouse gases, but then they started to politically interfere with the communication of the climate change science in such a way as to sort of conform it to their political position. And for example, they suppressed all official use of or even reference to the National Assessment of Climate Change Impacts, a major study that had been done under the federal program's sponsorship that identified a wide range of likely impacts of climate change on the United States. This was a discussion that they didn't want to follow up on, no follow-on studies, no interacting with stakeholders. And then I was working on things like the annual report to Congress and the strategic plan for the program, things that, not the technical science literature, but when the climate change stuff is communicated to a wider audience. And they actually put a former oil industry lobbyist in the White House in a high-ranking position in the White House Environmental Policy Office, and he sort of got a 12th-hour sign-off and editing crack at everything that came out of that program, basically, after it had been approved by all the career senior federal science program managers and had been written by the scientists. He would edit it to play down the global warming problem, to make a long story short. I mean, introduce a lot of uncertainty language that had not been there, to delete discussion of climate change impacts. And I finally just found it an unworkable, I mean, if you're interested in honest communication and what happens on the receiving end of the science, I found it just an unworkable situation. So I resigned, I went public, I turned some documents over to the New York Times. They covered the story. The oil lobbyist resigned from the White House. He went to work for ExxonMobil. I mean, it was a classic fox guarding the chicken coop story. You didn't need to know too much about trace gases and polar bears in order to understand what was going on. And that, I think, was just a case example of a really widespread pattern with the administration.
Now, the administration would contend that they're not getting a fair shake, that in fact they in many ways are a very pro-science administration, and what they'll often point to is, for instance, the increased aid that the administration has provided to addressing HIV/AIDS in Africa. Are we not being fair to the administration in how we're evaluating its role on balance? Francesca Grifo.
Well, I think what we've tried to do is put on our website, 70 to 80 examples that have primary documentation. We're not asking you to believe us. We've supplied the documents. But when you have something like, Julie McDonald changing the meaning of a scientific document, she was a deputy assistant secretary at Interior in track changes, and we have the document with the track changes. If you have, lead lunch boxes where there's lead in the vinyl, and you have the Consumer Product Safety Commission changing the scientific methods, telling the scientists to use a different method to test for that lead. I mean, these are pretty blatant, major things, easily traceable, easily documented.
Okay, well, let's assume that everything you're saying on your website is accurate and true. Is this simply a leadership issue, that we change the leadership and we're going to have a fix all the problems, or are there fixes, corrections that may take years to put in place, Rick Piltz?
Well, I think that there are built-in problems that the new administration will need to be watchdogged on that won't necessarily go away automatically. I think on this, the question of the Bush administration, where we particularly saw problems was where the administration seemed to be representing particular economic interests that wanted to avoid regulation, for example, on environment, or wanted to head off regulation of greenhouse gases. And so where the scientific evidence might strengthen the case for a stronger policy, a stronger regulatory policy, that's where the interference was most likely to happen. So the question is, what interests will the new administration be representing? What kind of tone will the White House set? Because we found with this administration that the problem started at the top with an apparent willingness to misrepresent intelligence in order to move a political position. So what kind of tone will you see them projecting integrity and an honest use of evidence? What will the president's party in Congress be doing? But I think in terms of the centralization of power in White House we've seen, the ability of political officials to manipulate scientific communication behind the scenes, the restrictive media policies for scientists' ability to talk freely with reporters, and that kind of thing, we're going to have to go case by case.
Well, what are we hearing from the candidates, from Senator Obama and Senator McCain, about what kind of science regime they would lead if they are elected, Francesca Grifo?
Well, right now we don't have a tremendous amount of details. Unfortunately, this issue has not risen to the top of their agendas. But we do see some promising aspects to both of their platforms in terms of transparency. And I think for us, that is one of the most critical things that has gone wrong in the current administration and really needs to change. And as you said, I think this is really about leadership. I mean, very early on in a new administration, they can send a signal, whether it's coming out of the Office of Science and Technology Policy and the Science Advisor, or whether it's coming from the President himself, herself, himself in this case, or whether it's coming from the agency heads. Things like going back to William Ruckelhaus's fishbowl memo, where he said early on, we're going to run EPA, this was 30 years ago, as if it were in a fishbowl. That kind of transparency can make a huge difference.
You said before that the candidates haven't spoken much to these issues. Is it really that they don't have positions on these questions, or that the media hasn't been paying attention to this issue?
I would say some of both, actually. I do believe there was a wonderful effort called Debate 08, and one can find detailed responses. There was a questionnaire, 14 questions, and the candidates did respond. But when it came time to try and have a real debate, a live debate about science issues, just couldn't make it happen. So both.
Okay. And Rick Piltz, your take on an Obama administration versus a McCain administration on issues of climate and science generally?
Well, on climate change, if you read their responses to questionnaires, both of them would be a step forward from the current administration in terms of acknowledging the scientific evidence about observed global warming, likely greater global warming, likely harmful impacts. There are differences in how stringent a policy they would support. I think the real question is beyond the questionnaire. What would they actually do? What would their transition to getting off of fossil fuels look like? If it's drill, baby, drill for more oil and embedding us deeper and deeper into a dependence on oil for the transportation system, that's not a solution to global warming. So there's just a lot, no matter what cap and trade legislation they support or what they negotiate post-Kyoto Protocol, there's going to be a host of implementation issues in this country because global warming is not a problem that's going to be like solved and go away. It's part of the fabric of our society now. It's part of the context in which society will be making a lot of important decisions. So do they have a proactive problem-solving approach to government? Will they have an activist federal government that really works with state and local officials and the private sector to solve real problems of mitigating and adapting to climate change? And
but what we're hearing on the campaign trail, at least, there's some grounds for optimism regarding both candidates in this regard. But it does occur to me that we're in a situation where, at least on the Republican side, we have a candidate for president who, based upon actuarial tables and his own history of health problems, may tragically not be able to complete even a single term in office. And were it to come to pass that Sarah Palin would rise to become president of the United States, what kind of science policy will we expect to see then?
There are real questions about Governor Palin in terms of her understanding of scientific issues, her willingness to acknowledge the way scientists think about things, whether it have to do with evolution or with human-driven global warming, that really suggest a lack of depth, a lack of understanding, and whether there's really the right values there to translate scientific evidence into good public policy. And I think this is the sort of thing that really needs to be looked at much more carefully before voters make their decisions, because there are too many unanswered. The media don't dig into this enough. The debate questions, the talk shows, they're all over the place, but they don't really come to grips with these science, environment, and energy issues in a way that would really help voters understand it well enough, I think.
Well, many thanks to Rick Piltz of Climate Science Watch and Francesca Grifo of the Union of Concerned Scientists for trying to set the record straight, at least, and for your insights on what went wrong during the Bush administration in science and how to fix it. Coming right up, will the U.S. Supreme Court bar lawsuits for harm caused by over-the-counter and prescription drugs? Welcome back to Whistle Where You Work. I'm Mark Cohen. Earlier this year, the U.S. Supreme Court ruled that a patient injured by a faulty medical device could not sue the manufacturer because the device had been approved by the FDA, the Federal Food and Drug Administration. Soon, the High Court will consider whether a consumer injured by a drug approved by the FDA is also barred from suing. In legal jargon, the issue is called preemption. The notion is the federal government, through the FDA, has the exclusive authority to approve new medical devices and drugs, to declare them safe and effective. So once a product is approved by the FDA, a state personal injury suit for failing to adequately warn of dangers is altogether barred, preempted. Not surprisingly, drug makers and the FDA both favor preemption, and trial lawyers and state governments oppose it. But there is a profound issue of justice at stake here, argues Simon Heller. Simon is the legal director of the Alliance for Justice, which strongly opposes preemption of personal injury lawsuits for drug injuries. Welcome, Simon, to Whistle Where You Work.
Thanks for having me here.
Simon, I think I was probably a little bit glib in my introduction saying that the FDA has good reason to support preemption. But really, in truth, the FDA is kind of a latecomer to the preemption bandwagon, isn't it?
Well, that's absolutely right. For many, many years, it has been widely held that people can sue if they're harmed by drugs in a way that a drug manufacturer failed to warn them about. And the FDA has actually supported that position, has not sought to undermine that until very recently, in 2006, when for the first time the FDA issued a guidance or a directive saying that indeed these lawsuits are also off limits for people who are harmed by drugs.
So it had been the case that the FDA had considered personal injury lawsuits a complement to its own regulatory authority until very recently.
Well, absolutely. The FDA, until very recently, I think, viewed those lawsuits as something that was helping them to do their job of making sure that drugs are as safe as possible, so that not only are they told by manufacturers when there are problems with drugs, but courts are, in essence, informing the FDA that there are problems with drugs that they don't know about.
Let's talk about the case of Diana Levine. Hers is the case that's now before the Supreme Court. It involves a drug called Phenergan, which is made by Wyeth Pharmaceuticals to treat nausea. And it's something that can be safely injected into a muscle. It's something that can be administered safely by an IV drip into a vein, but it can't be injected into an artery, which can cause arteriospasms, it can cause arteriospasms, it can cause gangrene. But that's what happened in her case, didn't it?
That's right. She went to a hospital in Vermont, where she's from, suffering from a severe migraine with accompanying nausea, and was treated with Phenergan, initially given an injection into the muscle, as is appropriate. But then, instead of receiving an IV drip, something called an IV push was done.
When the migraine didn't go away.
Exactly, when the nausea continued. And that IV push inadvertently or by accident entered the artery, and the result was that she lost part of her arm from gangrene. This is a nightmare that few of us would be willing to have, even in our sleep, going to the hospital for a severe headache and coming out with the loss of an arm. And this is someone whose livelihood was as a musician. So it has really had a tremendous impact on her life.
I think the trial judge said it was as bad an injury case as any court is likely to see.
It's certainly among those.
She was awarded $6.75 million in a verdict against Wyeth. And the Vermont Supreme Court upheld that verdict. Now, Wyeth says that they shouldn't have to pay anything, that really the whole problem here was that the clinic erred in its application and in injecting the Phenergan into the artery, and that the label on Phenergan, in fact, warns against injecting into an artery. Isn't that true? And if that's the case, why should they be on the hook for this?
Well, a couple of things. Of course, the hospital and the doctors bear some of the responsibility for what happened, but the label for Phenergan does not warn against doing what's called an IV push. It does not tell physicians and hospitals that they should avoid this route of administration of the drug, and it doesn't tell patients that either.
What is an IV push exactly?
It's essentially pressing the drug into a vein, but when doing so, there's a risk that it goes into an artery instead, as opposed to an IV drip, which slowly administers the drug and can be monitored very closely. So their label doesn't warn about this, and that's the essence of the case. They had known for many, many years about multiple people who had suffered gangrene and loss of limbs from exactly this, from IV pushes, and had never added it as a warning to their label, had never even sent a letter out to doctors saying, be careful about this, both of which they could have and should have done.
Now, Ms. Levine or her lawyers argues that Wyeth had a responsibility to change the label in order to better educate those, instruct those who were administering this drug on the danger of the IV push. But they didn't do that. Wyeth contends that they weren't allowed to do that, that under FDA rules that they can only do that for newly discovered information, that is, information that's discovered after the approval of a drug.
Well, that really comes down to what's at the heart of this case, in some sense, a piece of the heart of the case, which is that argument really right? The problem with the IV push came after the original labeling of the drug. And what the manufacturer is in essence saying is if we find out about something later, unless we found out about it very recently, we don't have to tell anyone about it. There is a process under FDA regulations for a manufacturer to just go ahead and warn people and then ask the FDA to approve the new warning. They didn't even do that. It's sort of an after the fact approval that they can get from the FDA. But even short of that, as I said earlier, they don't even have to warn through the label. There are a lot of other ways to warn physicians and patients about the risks of a drug. They didn't do any of that. And so they left people like Ms. Levine with a sort of terrible, terrible surprise, which is this terrible gangrene and subsequent loss of her arm.
I mentioned in the introduction that in a prior decision, the Supreme Court ruled that there is preemption for suing over faulty medical devices. That's called the Regal decision. But in Regal, unlike the drug context, there was express language in the statute saying that these state suits are preempted, isn't there?
Well, what there was in Regal and what is lacking in Ms. Levine's case is there was a statute that Congress had put into place that said that conflicting or inconsistent state law was preempted, couldn't be applied. Even given that, one of the main authors of that statute, Senator Kennedy, submitted a brief to the Supreme Court saying, well, what we intended to say was you can't have a state statute that's in conflict. We never intended to displace lawsuits by people. But in the case of Diana Levine, it's even more far-fetched, the argument, because not only is there no statute from Congress saying we're preempting anything, there in fact is a statutory provision saying that in general the law is not intended to preempt anything by states, let alone state lawsuits.
But there is a general provision that provides that if there is a direct and positive conflict between the FDA law and a state law, that the FDA law occupies the field. And in fact, here is a situation where FDA said that the label was valid, and a state court essentially found that it was not, didn't it? So isn't that a direct and positive conflict?
Well, not really. And in fact, I think in essence, Wyeth has conceded in the Supreme Court that there isn't the kind of direct and positive conflict that statute would apply to. In fact, there is really not necessarily a conflict at all. The FDA approved a label with a certain group of warnings, and because the FDA's own procedures allow the manufacturer to add to those warnings if there are new risks or different risks discovered without prior approval from the FDA, the manufacturer could have gone ahead and done it anyway. And of course, what's more, what the Vermont court has said in essence is, you didn't warn this patient and these doctors about that risk properly. There are other ways to do that other than through the label. And of course, what's the bottom line? The manufacturer wants to avoid paying money. Even if it paid Ms. Levine all the money that the jury awarded to her and that the Vermont Supreme Court said she was entitled to, they don't have to change their label. The label can remain the same.
All right, we're nearly out of time, but Congress is concerned about this issue as well. They haven't, as you indicated, ever said that these suits should be preempted, but there's a push in Congress to expressly say that they are not preempted, is there not?
That's right. I think Congress is going to try to deal first with the question of devices, where you have an existing Supreme Court decision that I think most in Congress believe is wrong, a wrong interpretation of federal law. And I think that Congress may await the result of the Wyeth case to decide whether to do something similar with drugs.
Okay. Many thanks to Simon Heller of the Alliance for Justice for sharing your views as to what's at stake in the Supreme Court's consideration of preemption. This could be the seminal issue on the court's docket this year. For Whistle Where You Work, I'm Mark Cohen.